When I would first meet a patient, the fundamental part for me is really building that relationship and making them as comfortable as possible. And the key thing is to ensure that we're on the same page in terms of why we're meeting. And sometimes patients will come along to a consultation, with different expectations. And for me, it's really important to explore those in detail so that we manage the relationship and manage the journey in terms of their care. I would see my role very much in facilitating their care and providing them with the best possible opportunity and options in terms of moving forwards. What's exciting for me is that particularly in liver disease management, currently we've got new tools at our disposal which allow us to intervene at an earlier stage before the liver disease becomes more progressive and, to a certain extent, irreversible. The clinical care around that is really about thinking about prevention and earlier diagnosis, as well as obviously managing complications as and when they occur if you're seeing patients at a later stage. I'm really passionate about what I do in terms of my patients because they're often quite fragile, and by the time we see them they can often be at a quite late stage disease. And it's all about building that trust and that secure environment for them to be as open and honest as they can be so that we can move their treatment along and try and provide the best possible outcomes. The other thing that I'm really passionate about is the work I do in my lab, which is looking at the role of the microbiome, or the collection of bacteria, fungi, viruses that live in our guts. We all have the microbiome in our guts and elsewhere, and increasingly it's really key that it's really obvious that these bacteria are really important in terms of our health, not just of liver disease, but gut diseases, neurological diseases and so on. So this is a particular area of research that we are very involved in. We're all very different as individuals, and we all come with different viewpoints and different experiences, whether it's life experiences or experience of healthcare. And I think it's really important to get into that and to really understand that individual person and to really treat them, based on all those different factors. And that takes time and it takes effort, but it's really important. And that's why the initial interaction for me is really key.